Thank you so much for being with us. Good afternoon and welcome to the Improving HPV and Pediatric Influenza Vaccination Rates in Louisiana webinar series. We are so pleased that you could join us today. I hope that this webinar series will become a virtual community where you can learn and connect with your peers. And during the series in today's webinar, you'll hear from experts and have the opportunity to ask questions and share comments. Here's just a quick overview of our agenda today. So we're going to have our presentation. You see, we will have time for questions and answers at the end. This educational series is made possible through funding from the American Academy of Pediatrics and brought to you by the American Cancer Society, the Bureau for Family Health School-Based Medical Health Centers, Louisiana AAP, Louisiana Office of Public Health Immunization Program, Louisiana Primary Care Association, Louisiana Shots for Tots Coalition, the LSU Health Science Center Dental Program, and Southeast Louisiana AHEC. The Louisiana AAP is accredited by the Louisiana State Medical Society to provide continuing medical education for physicians. The Louisiana AAP designates as live activity for a maximum of 1 AMA PRA Category 1 credits, and physicians should claim only the credit commensurate with the extent of their participation in this activity. This activity has been approved for 1.1 contact hours of nursing continuing education by Workplace Nurses LLC. All improving HPV and pediatric influenza vaccination rates in Louisiana, planning committee members have indicated that they have nothing to disclose. This session is being recorded for educational purposes. A video recording of this presentation will be shared following today's presentation. By participating in this webinar, you give your acknowledgement and consent for recording. As such, please ensure that patient privacy is protected and do not provide any PHI during today's Q&A session. And some last minute housekeeping. Please make sure your microphone is muted during the session. You will have the ability to mute and unmute yourself to participate in today's call. If you do have any technical difficulties, please contact Ashley Pullitz in the chat box or text her at 225-505-7611 and she'll be able to assist you. If you have video capabilities, please enable them during our Q&A session today. It makes for a more interactive and engaging session when we can all see each other. And finally, if you haven't done so already, please enter your name and where you're from in the chat box so we can get to know each other, and it is a way for us to capture your attendance. So we are really excited about today. Our webinar is on Louisiana data and resources and will be presented by Liza Smith. Liza is the HPV outreach coordinator at the Louisiana Office of Public Health Immunization Program. Her passion and motivation to help others and save lives drew her to this work. As HPV outreach coordinator, she meets with organizations, providers, and healthcare professionals across the state to decrease incidence of cancer caused by HPV. She is driven to educate others about this virus and lift rates of vaccination in Louisiana. So with that, I'll turn it over to Liza.
Hi, everyone. I'm excited to be sharing a bit with you today about HPV and the Louisiana data and resources. I'm going to go ahead and share my screen with you. All right, can everybody see my screen?
Yeah, looks good.
Okay, perfect. So I know that we went over this a bit last week, but I do just want to go over some basics of HPV again. So HPV stands for human papillomavirus. It's the most common sexually transmitted infection, and nearly 80 million Americans have HPV. Not necessarily cancerous forms, but HPV in general. 14 million, a little over, are newly infected with HPV each year in the United States alone. And of that 14 million, 7 million, so half of it, are in individuals between the ages of 15 and 24. So it's definitely affecting younger people just as much as those who are in their mid to late 20s and up. So this is why it's even more important to vaccinate before it's too late. And HPV is so common that almost everyone will have it at some point in their lives. Again, not necessarily a cancerous causing form, not necessarily one that will cause genital warts. Most instances of HPV do clear up on their own, but there are also many cases in which it doesn't, and it leads to something far more serious. So on that topic, HPV is linked with over 90% of cervical and anal cancers, about 70% of mouth and throat and neck cancers, and over 60% of penile cancers. The issue here, and the reason that these numbers are so high, is because of low HPV vaccination rates. There's over 35,000 cases of HPV cancers each year in the United States, over 32,000 of which could be prevented with the vaccine. And as I mentioned before, HPV causes genital warts, many kinds of cancer, and nearly all cases of cervical cancer. So the vaccine is cancer prevention. Boys and girls. Originally, when HPV came out, it was only when the Gardasil vaccine came out, it was only licensed for girls. A common misconception is that it's still only for girls, but that is not true. It is for girls and boys. The vaccination series should be completed by age 13. Anything later than that should be considered late. Starting in, I believe, July of 2019, we started measuring HPV vaccination rates at age 13 instead of age 15. Before age 15, starting the series before your 15th birthday is 2 vaccines, and after it's 3. So the series should be started at age 9. Speaking to healthcare providers in Louisiana who have the highest rates of series completion, I asked them, what's your secret? Why do you think that your rates are so high and you have such great success? And all around, one of their answers was they started at age 9. They didn't wait until 11 or 12 years old to start the vaccine series. They started at 9, and they had very high completion rates, over 90% by the age of 13. And so vaccinating by 13 results in a strong immune response and gives long-lasting protection. The age at which you're vaccinated, as the age increases, the protection decreases. So it's important to get the children vaccinated as soon as possible. If given at the recommended age, it's over 90% effective. And there's also catch-up vaccination through age 26, and then from 26 to 45 is something that should be a conversation with your doctor. Cervical cancer is one of the cancers caused almost solely by HPV. It's the 4th most common cancer among females and the only one that's vaccine preventable. Louisiana is not doing so great. It has the 6th highest incidence and death rate of cervical cancer in the United States. So that's pretty high. Yet another reason that the vaccine is hugely important. We certainly want to bring that number down. That's not a good thing to be ranking highly of across the states. So for up-to-date HPV vaccination, so for individuals who have completed the vaccine series, here are some statistics. So the average nationwide rate in 2019 was 54.2% of series completion. The Louisiana rate was actually higher at 59.5%. So we had a significant increase of about 7% from 2018, where the rate was 46%, compared to the nationwide rate, which was 51%. You can also see here the rates between males and females. Although we don't yet have rates for 2020, HPV vaccination has dropped 21% since the pandemic hit. So we're down over 1 million doses. That's according to the CDC, MMWR report, and many different sources. So we are seeing a significant decrease. A trend that is true across the United States and Louisiana is that between the first dose, the difference between those who start the HPV vaccine series and those who complete it, it's about a 20% difference. So the drop is very significant. So if we look here at the average Louisiana rate for 2019 of about 60%, the people who started the series would be closer to 80%, except those who finished it was closer to 60. So there's a very big drop there. And that is showcased in this graphic, which also shows some other immunizations. We can see that others don't have as significant of a drop. But if you look at HPV, which is the thicker dotted line, I'm not sure if you can see my mouse, but it's the line right in the middle. And then if you look at HPV up to date, which is the small dotted line, there's a 20% decrease in there. A big concern is whether vaccine is safe, whether it's effective, whether it provides long-lasting protection, and it does provide all of those. As I mentioned before, it's over 90% effective when given at the recommended age. There's no evidence of waning protection, and the benefits of HPV vaccination far outweigh any potential risks. The only common side effects of the vaccine are those that you get with any vaccine, so pain and redness in the injection site, some swelling, potential nausea or dizziness, but nothing extreme, nothing that would set it apart. So, as you know, one of the main topics we'll be going over today is data and some resources that we have for you. So I'll be going through just some of the resources that we have. We'll be sending everyone a little sample packet of resources, which will include these that I will be sharing with you today. We did email everybody earlier this week asking for your mailing address through a SurveyMonkey link. If you could please fill that out, we would love to get these to you for no cost to you. We'll also be sharing a link in which you can order more resources. We'll only be sending one copy of each resource so you can see what you like, see what you don't like, see what would work best in your practice, and what your patients would respond most to. And later, you'll have the chance to order more at no cost for you, except for, I think, one resource, which is the one on the screen right now. You would have to pay for that one, but everything else we could provide at no cost to you. You can expect to get these packets late April, early May. we're hoping to send them out by the end of this month. So don't expect to see it in the mail in the next 2 weeks, but sometime after that. So this resource here is from the AAP. And not only does it focus on HPV, but it focuses on many other vaccines, viruses, infections. So with Tdap and hepatitis, HPV, the flu, etc. And this resource is so great because it gives you explanations and thought processes and anything that you could think of for patients and parents, and also for clinicians. So it's a great resource for all parties involved. These are some flyers that we'll be sending to you. The one on the left is some information with some commonly asked questions, things that healthcare providers and everyone here today, I'm sure they're questions that you get asked a lot. Through my work, I've found that many healthcare providers are not as educated on the HPV vaccine as we would hope, but that's because they have so much to remember, so much to focus on, so much to talk to their patients about. So these sheets are just a way to give them little reminders, educate them, but also things to share with parents and patients, which is what this document on the left is. You could give this document, this sheet, to the parent and patient when they come in for them to look over, maybe when they're waiting in the room for the doctor to see them, just, to cover things and educate them, because a provider recommendation is the single biggest predictor of whether they'll get vaccinated. The more information they have, the better to, combat misconceptions and whatnot. The resource on the right is directed more towards healthcare professionals and those in the practice, just some tips and reminders of how to best approach it. Here are some more that we'll be sending to you. Again, on the left is targeted towards parents and patients. It goes over the dosing schedule, but again, not just HPV, but other vaccines that could be administered at the same time. So for those aged 11 to 12, if they haven't started the HPV vaccine yet, they'll be in the office at this time anyway to get the meningococcal vaccine and the Tdap vaccine, and hopefully also the flu vaccine. But this is a great time to group them all together, to say, today you're due for 3 vaccines or 4 vaccines if you want to include the flu vaccine. And to say that instead of saying, you're due for the meningococcal and Tdap vaccine today, and you can also get the HPV vaccine, which prevents against cancers caused by human papillomavirus. Instead of giving them the option, instead of phrasing it as something they have to opt into, it's better to phrase it as something they have to opt out of. We've seen that that has made a large difference in the rates across Louisiana and across the country as well by grouping it with other vaccines, utilizing the fact that they're already in the office. You don't have to schedule an appointment just for the HPV vaccine, because many patients don't come in every year. They only come in when they're due for a shot or have a sports physical or need a form for school or whatnot. The HPV vaccine safety and effectiveness document you can see on the right of your screen that is addressing a lot of the concerns that parents and some patients have about whether it's safe, whether it's long lasting, whether it's effective. And this just kind of goes into more detail, and coming from the CDC, it's a reliable source. If someone, for some reason, may not entirely take their doctor's word and want more information, parents always want more information. And so this definitely explains it a bit more. So on the left is a document. Well, both of these are in Spanish. So what we will be sending you, we'll send some things in English and some things in Spanish, since across Louisiana, there is a significant Spanish-speaking population. I've found that a lot of the places I meet with are also looking for Spanish resources. And this is helpful instead of, running the risk of things getting lost in translation. On the right of your screen, this is the beginning of some posters I'll be showing you. We'll be sending everyone who provides their mailing address, reminder, fill out that link to provide your mailing address. We'll be sending everyone a total of 7 posters, again, which you can order more of to hang up in exam rooms, the waiting room, anywhere that you think would be best. So we have posters that have children of all different races and ethnicities, male and female, English and Spanish. This resource on the left, I really like the way that these posters are made. They're not things to just scare you into getting it, but they're very thought-provoking. To pose the question, if there was a vaccine that you could give your child to protect them against cancer, wouldn't you get it? Why wouldn't you get it? Tell me a good reason that you wouldn't. So this just shows that there's a way to protect them against cancer. And cancer affects nearly everybody, whether you're the one who has it, whether you have a family member or a friend or a coworker or an acquaintance. Everybody knows at least one person with cancer or who is affected by it. And this is just a reminder that you could save your child from getting these kinds of cancer caused by the human papillomavirus later in their lives. The resource on the right, we have that, and we also have the exact same poster, but in English, so you'll get both of those. And so, as I said, those are only some of the resources we'll be sending you. We'll be sending a lot more along with that. Just kind of wanted to give you a sense for what will be coming your way. Again, some things are targeted towards patients and parents. Some things are targeted towards healthcare professionals and providers, but there really is something for everyone. Something that can inform you and help you in your practice and increase the rates across Louisiana. So here are some other tools and resources to support your work and increase the vaccination rates in your practices and in turn the state. So the top part of this are some other organizations and websites that you can go to get more information. So the HPV Vaccination Roundtable is exactly what it sounds like, focused entirely on HPV. So if you go to this website, There's a lot of resources. There are things that you can order if you want to get more resources than the ones that we send you in your packet. The ACS Mission HPV Cancer Free, another great website. All of these have websites that delve into HPV, that explain what it is, what the vaccine does, some statistics and rates, nationwide rates, not Louisiana specific, but that's still helpful. Also the CDC and Merck, who is the sole manufacturer of the Gardasil 9 vaccine, and the AAP. Many of these are, organizations that are making this webinar series possible. And they also have wonderful resources. Some ways to increase rates that we've found are very successful. The first is reminder recall. As I mentioned, there's a significant drop between those who start the vaccine series and those who complete it. Again, that's about a 20% difference in rates. A lot of this is because patients aren't reminded that they're due for their second vaccine. They don't receive a reminder in the mail. They don't receive a phone call. They don't receive an email. And of course, that is a lot for providers to take on, to send all of that out, but it really does make a huge difference. Providers they have the ability to save lives through this. Everybody here today has the ability to do that, to spread the word about the HPV vaccine, to advocate for it, to educate people and, make sure that there's no confusion, to answer questions, just to be a resource. And one of those ways as a provider is to make sure that you are getting your patients the vaccine and getting them back in the office to complete the series. Another way to boost rates is to hand out materials, hang up posters, have things that your patients can take with them instead of just the singular vaccine sheet that just tells you what it is, but to have resources and documents such as those that will be sharing with you to teach them more. If they're hesitant when you bring it up at a visit at 9 years old, send them home with these resources. They can take them. We can send you more to hand out, but so that they can go home, they can read over it, or they can read over it while they're there and understand the importance of it. Another way to result in an increase of rates is to group vaccines in one visit. I know I mentioned that earlier in this presentation, but if a patient comes in at 9 years old or 10 years old and isn't ready to get the vaccine yet, when they come in at 11 or 12 for their Tdap and meningococcal, to group it in there and to give them all three in the same day. Nothing has been discovered that it can't be given at the same time as other vaccines, and it is totally safe to administer the vaccine at the same time as the Tdap and meningococcal. With COVID, since that is so prevalent right now, it is suggested that nobody receives vaccines within 14 days before their first COVID shot, the entirety of the time between, and the 14 days after. So that could result in an 8-week gap between vaccines. So that is something to consider. But again, since the patients who are receiving this vaccine are younger than the ages for which to receive the COVID vaccine, that shouldn't be much of an issue until guidance is released that COVID vaccines can be administered to those significantly younger than now, but that is something to keep in mind. Again, begin recommending the HPV vaccine at age 9. It is never too early to get it into their minds. It's never too early to start talking about it, but to start getting them vaccinated at age 9. And if there's a longer gap between 2 vaccines, it increases the likelihood that they'll have the series completed by the age of 13. Because as I mentioned before, there's 7 million new cases of HPV in those between the ages of 15 and 24 each year in just the United States alone. So we're seeing that this is really affecting young people. So the earlier that we can administer the vaccine, the earlier that we can get it in the thought process and normalize it, the better. And one last idea, these are definitely not the only ways to increase rates, but to make sure that your staff is educated. This vaccine should be recommended from the second the patient walks into the door to the time that they leave. When they're checking in, if the person checking them in wants to say, just so you know, you're due for the HPV vaccine today, maybe even say there's some resources on the table over there, having them in the waiting room if you want to read over them to see what the vaccine's all about before you go meet with your doctor. That's an idea. The nurses should be recommending it. The doctor should be recommending it. And the second or third vaccine in the series should be scheduled before the patient leaves the office. If they have a card saying when their next vaccine is, they can hang it up on their fridge. It's much less likely that they'll forget if they have a physical reminder. We can't rely on them to call back and schedule the next appointment on their own, because I don't know any child, and I was certainly not one who looked forward to getting shots. I always tried to get out of it. And so it's less likely that they'll call themselves, that they'll take the initiative to schedule the next dose. We need to do that for them. And then if they have to reschedule, we'll still have them in the books and they'll be able to complete the series. We'll reduce that 20% gap and increase the rates across our state. And this slide is for Louisiana specific. These are the Louisiana Department of Health reps by region. So I know that everyone on the call today, those of you watching this recording, are in different regions of our state. And this document will show you the people that you can reach out to in your region if you have specific questions that maybe I can't answer, if you want to know your own rates, if you want to just form that friendship. If you are a provider, odds are you have already met the representative in your region or talked to them. But this is just a page that shows you those resources specific to where you are located. And with that, I am happy to answer any questions, but I also want to say that I am a resource to all of you. I am more than happy to answer questions, put you in touch with region leads, provide resources, meet with you to come up with a plan to increase your rates, meet with you if you want more education or information. I am 100% a resource. My email is down at the bottom of the screen. I'm sure that Ashley can share it as well, Ashley or Caitlin, so that you have it, and feel free to contact me whenever.
Thank you so much, Liza. That was such a great bit of information. I will direct everyone, I did put the link to the survey to send us your mailing address so you can get that resource packet. That is in the chat box. So if you want to click on it now, and that way you can answer it later. But I'll just open the floor up now to everyone for questions, and encourage you to show your video so we can have a more interactive discussion. And Liza, if you wanted to stop screen share, that you could do that as well. So just remember just to unmute yourself, or if you have a question that you want to put in the chat box, feel free to do so now. And while everybody's thinking of their amazing questions to continue the conversation, Liza, I had a couple of things that maybe would be helpful to the group. Is there a place where folks can go to get the contact information for the regional representatives that you just showed on that slide?
Yes, so the LDH website for the OPH immunization program, there is a section where you can see per region. You can click on it, it'll tell you the address, phone number, and if I'm correct, should also provide an email that you can reach out to.
Wonderful. So what we can do for everybody who is here, we will put that together maybe on a spreadsheet, or at least a link to that in the follow-up email you'll receive with the slide deck and recording today. So I'll be quiet for a little bit and see if anybody has any questions or thoughts, or maybe things that worked well in your office setting that you'd want to share with the group.
Also, I'm popping that link in to the chat box now. That will lead you
Perfect.
to
Thank you.
the region page on our website. Also, if anybody has any ideas or requests of something that may be helpful, or resources that we could create or find for them, you can definitely let us know that now as well.
So it looks like there's a question: are HPV vaccination rates available by region in Louisiana? That's from Jennifer Herrick. And I believe Jennifer's asking for vaccination rates, like percentages and data.
So I believe that they should be. As I mentioned before, that's something that you could contact your region lead about, and they will get in contact with the links team and run the rates. I don't know if we have it divided by region right now, but since we have providers divided by region, there is no reason that we wouldn't be able to do that. And I know that would actually be very helpful. I was hoping to have those numbers for y'all today. Didn't get them in time. Links is super busy with all the COVID reporting and all of that. But if you do touch base with your region representative, they should be able to get you those rates.
Thank you so much for that question, Jennifer. What about others on the, I'd love to hear what things have been successful in your practices, or maybe things that are challenging that there might be some idea sharing with the group. Got a quiet group today. Everybody's busy eating lunch, I suppose. Well, I'll wrap up a couple of things. So as Liza said, we will start sending out those resource sample packets in the next couple of weeks. So as we get folks mailing addresses, we'll get those out to you. I hope that you find that helpful. And then it will have kind of an order form for you to go online and make the request for those additional copies of Liza and her group. I will mention the AAP little book that Liza showed you, that table of contents in the beginning. That is something that we are able to provide through this grant funding. I'm very excited to be able to provide that to you guys. If that's something that you would like to order additional copies of, reach out to me. I may be able to negotiate some member prices that I can help with offset some of the cost of that. So excited to do that. And if there are folks that you know who maybe haven't registered for this series, but are interested in receiving some of that information, feel free to share that link with them. With the more the merrier. We really just want to get information out to folks so you have resources to share in your office, to share with your staff. One thing I will mention, just to be thinking about, Liza mentioned about the COVID-19 vaccine and the issues with co-administration. One of the things that the Louisiana chapter is really trying to encourage providers looking at your regular and even back to school vaccines and getting kids up to date earlier than the summer. We anticipate that the Pfizer will be applying for an EUA for the 12 to 15 age range in the next very short period. So that may be authorized for the 12 to 15 age group before school starts or right at the beginning of school. So we really want to make sure that everybody's caught up with their regular Bright Futures recommended vaccines before school starts this year, so that we can get them in for COVID as well. So just some thoughts. I know it takes planning and practice and a lot of phone calls and reaching out. And again, that's something that Liza and the immunization program is here to help you with, thinking through strategies on how to reach parents, thinking through ways of communication, how to use the links system to identify missed opportunities, and using the reminder recall systems that are built in there. So with that, one last opportunity, if anybody has any last questions. Well, I'm not seeing any hands or anything in the chat box. So you should see on the screen there, our next webinar will be April 22nd, and we'll be in the same Zoom room. The link there for the evaluation, this is how you'll be able to claim your CME credit and give us feedback so that we can know how we're doing and what we can improve on. That link is also in the chat box. So again, if you want to click that link, we tried to make it short and easy for you. And with that, we'll give you a little bit of your time back. I hope you have a great rest of the week.